Can wound dehiscence be prevented after surgery? Have you ever wondered if it is possible to prevent wound dehiscence after surgery? This condition, where a surgical wound partially or completely reopens, can be concerning. Understanding how to manage your health after surgery is key to a smooth recovery. Wound dehiscence can lead to complications like delayed healing and increased risk of infection. It is important to take steps to prevent this from happening. One of the most effective ways is to follow your surgeon's instructions closely. This includes how to care for your wound, when to change dressings, and any medications prescribed. Another important factor is to avoid putting strain on the wound area. Generally, it is advised not to lift anything heavier than 10 pounds or engage in strenuous activities during the first few weeks after surgery. This helps to minimize pressure on the incision and supports healing. When you cough, sneeze, or move, it is helpful to support the wound. You can do this by gently pressing on the area with your hands or using a pillow. This technique, known as splinting, can reduce stress on the incision. Nutrition and hydration play a significant role in recovery as well. Eating a balanced diet and staying hydrated can promote tissue healing. Poor nutrition and dehydration can weaken the healing process, increasing the risk of wound dehiscence. Keeping the wound clean and dry is essential. Following hygiene instructions can help prevent infections, which are a major risk factor for wound separation. It is also important to avoid constipation and straining during bowel movements, as this can increase abdominal pressure and stress the wound. If your healthcare provider recommends any support devices, such as abdominal binders, be sure to use them. These devices can help reduce tension on the wound. Gradually increasing your activity level is also important. Light walking is usually encouraged early on to prevent complications like blood clots, but more vigorous activity should wait until the wound is stronger, typically after 2 to 4 weeks. Do not forget to attend all follow-up appointments. Regular checkups allow your healthcare provider to monitor your healing and address any early signs of problems. Certain factors can increase the risk of wound dehiscence, including poor nutrition, infection, diabetes, obesity, and smoking. Managing these conditions before and after surgery can help lower your risk. If you notice any signs of the wound opening, increased pain, unusual discharge, or swelling, contact your healthcare provider right away. Early treatment can prevent worsening of the situation. In summary, while wound dehiscence can be a concern, it can often be prevented with careful post-surgery care, avoiding strain on the incision, supporting the wound during movements, maintaining good nutrition and hygiene, and closely following your surgeon's guidance.